Hey, are you pregnant and hoping to avoid a cesarean? I have the top 10 signs for you that your provider is planning on doing an unnecessary cesarean. Just saying that probably makes you kind of go, what? And for the record, I did not actually write this list, but an obstetrician did, named Dr. John Weinstein out of Frisco, Texas. Number one is your doctor arrives in L&D immediately after office hours and suddenly says he thinks that this baby is not going to fit. Well, it's not just after office hours. We see it before office hours and during lunch. Any hourly evaluations of C-sections have an increase in them first thing early in the morning, midday, and then after office hours consistently. Number three, during your third trimester, they say that they think this baby is going to be big and that you should do a C-section. But it's important to know, he references here how the American College of Obstetricians and Gynecologists has very specific guidelines about when to offer an automatic C-section for a big baby. And that's a baby that weighs over 11 pounds. Number three, we should induce you at 39 weeks. This is happening every day, all day long. Induction of labor at least doubles your risk of cesarean delivery without reducing shoulder dystocia. If you go read this article, he addresses the ARRIVE trial, which suggests that 39-week induction reduces the cesarean rate, but it's being debunked all over the place. Performs routine ultrasounds at the end of pregnancy to see how big your baby is. Just take a minute to read that. Pause. Number five, you have a history of herpes, and so the doctor tells you should just automatically schedule a cesarean. There's medication that you can take to prevent an outbreak during labor. That's the only risk. If you have an outbreak, you do need to have a cesarean, but if you're not having an outbreak at the time of delivery, it's not an issue. Your baby is breech, so you automatically have to have a C-section. Your provider should be offering you an external version. Many providers are not trained in breech delivery, which is what makes it unsafe. If you want to know more, I would highly recommend that you check out Heads Up, the documentary about breech delivery. When they want to do a C-section when you've been pushing only for 2 hours with an epidural, that, by the way, makes it really difficult to feel what you're doing down there. ACOG says that 3 hours of pushing is normal. Or your doctor is just randomly suggesting an induction at 39 weeks for no particular reason, but because it's convenient for you and them. But you have a much higher risk of ending in cesarean, especially if you're not dilated at all when the induction starts. Twins should not be an automatic C-section if at any point your doctor tells you that your pelvis is narrow. And here's a bonus tip. Pause to read. I love it when obstetricians are honest about what's happening. Like and